Imagine going to a hospital for a crucial, perhaps life-saving operation, only to find that the doctors have vanished. Not just on strike in a way that can be planned for, but vanished without a trace, with hospital managers left completely in the dark about who will even show up for work. This isn't a scene from a Hollywood thriller. It is the terrifying reality that could be facing Britain's National Health Service in just a matter of days. A fresh wave of strikes is looming, and this time it could be cripplingly different. We are on the brink of a massive 5-day walkout by resident doctors, set to run between the 25th and 30th of July, and the government is scrambling to prevent a healthcare catastrophe. Today, we will dissect this high-stakes standoff that puts the nation's health in the crosshairs. Why are doctors who dedicate their lives to saving others prepared to take such drastic and potentially dangerous action? What controversial, behind-the-scenes deals is the government trying to push through to avert this crisis? And most importantly, we will explore the government's flagship proposal, a plan to give British-trained doctors priority for jobs. Is this a genuine solution to a growing problem? Or is it just a clever smokescreen designed to distract from the real, festering wound at the heart of this dispute? A staggering 20% pay cut in real terms over the last 16 years? The core of this conflict, the very epicenter of the earthquake threatening to shake the National Health Service to its foundations, is money. The British Medical Association, the powerful union representing the doctors, has laid its cards on the table. They argue, with years of data to back them up, that the value of a doctor's salary has been systematically eroded since 2008. When you account for inflation, they are working harder for significantly less pay, to the tune of a 20% real terms pay cut. Think about that for a moment. Imagine your own salary being worth a fifth less than it was 16 years ago, despite your skills, experience, and responsibilities growing year on year. This isn't just an abstract economic statistic. It's a daily reality that grinds down morale and forces talented individuals to question their chosen career. Many resident doctors start their careers burdened with six-figure student debt, a financial mountain they must climb while working some of the most demanding and unsociable hours imaginable. They are the ones on the front lines at 3 in the morning, making critical decisions in high-pressure emergency rooms. They are the ones holding a family's hand while delivering devastating news. To do this work while knowing that the system they are dedicating their lives to values their contribution 20% less than it did 16 years ago is not just a financial insult, it's a profound psychological blow. It sends a clear message. Your sacrifice is not appreciated, your expertise is undervalued, and your well-being is secondary. In response to this, the government, led by Health Secretary Wes Streeting, has made an offer of 5.4% for this financial year. But to the doctors, this doesn't even begin to touch the sides of the problem. It's a small plaster on a gaping wound. The government's position, however, is firm, almost immovable. In a letter to the British Medical Association, Streeting was blunt. While we cannot go further on pay this year, there is so much more we can do together. This single sentence perfectly encapsulates the deadlock. The government is saying, we'll talk about anything, literally anything, except the one thing you say this is all about. This has created a chasm between the two sides, a valley of mistrust that seems to grow wider with each passing day. The doctors see it as a refusal to acknowledge the fundamental problem, while the government frames it as a responsible fiscal decision in tough economic times, insisting the public purse cannot stretch any further. This is the intractable conflict that is pushing the National Health Service towards the edge of a cliff. So, if the government won't budge on pay, what exactly are they offering? This is where the political maneuvering gets truly interesting. The headline proposal from Wes Streeting's team is a major reform to how doctors are hired. They are preparing to offer UK-trained doctors greater priority for jobs within the National Health Service. To understand why this is a significant bargaining chip, we need to rewind to the year 2020. At the height of the pandemic, with the National Health Service facing an unprecedented workforce shortage, the then Health Secretary, Matt Hancock, made a pivotal decision. He expanded the competition for training posts to include applicants from all over the world. On the surface, it was a logical move to fill desperate vacancies. However, it has had a profound and, for many, a negative unintended consequence. It created what is now being described as a severe bottleneck. There are now far more doctors, both UK-trained and international, competing for a limited number of available training positions than there are posts available. This means that young British doctors, after years of grueling study and accumulating massive student debt to train here, are finding their career progression slowing to a crawl. They are stuck in a queue, unable to move on to the next stage of their specialty training, not because they aren't good enough, but because the competition has become impossibly fierce. This policy shift has its roots in the government's own long-term workforce plan for the National Health Service, which already stated a goal of dramatically reducing reliance on overseas recruitment, aiming for no more than 1 in 10 new hires from abroad. What West Streeting is offering now seems to be an acceleration and a reframing of that existing policy, presenting it as a direct concession to the striking doctors. It's a politically astute move. However, it raises deeply complicated questions. While it may soothe the anxieties of UK graduates facing a career logjam, it risks creating a new kind of division within the National Health Service. How will this affect the morale and integration of the thousands of international doctors who are already the lifeblood of many hospitals? Does it risk sending a message that their skills are somehow less valued, creating a two-tiered system based on nationality? Furthermore, critics might argue that this entire issue of the bottleneck is a problem of the government's own making, a direct result of failing to adequately fund and expand training places in line with the number of medical school graduates, both domestic and international. This is a really complex issue, a global pandemic policy now creating career gridlock for our own doctors. If you're finding this breakdown useful in understanding the nuances, do take a moment to hit that like button to let us know. It genuinely helps us continue to dig deeper into these crucial stories that affect us all. Beyond the headline-grabbing jobs plan, the government's negotiating table has other items on it, seemingly smaller concessions that speak to the daily grind of a doctor's life. The health secretary is said to be open to discussing improvements to how annual leave is managed and how specialty rotations are handled. These might sound like minor administrative tweaks, but for resident doctors who are often moved between hospitals and departments with little notice, disrupting their lives and their families, these are significant quality of life issues. But lurking in the shadows of these talks is a far more controversial and secretive proposal. Insiders have insisted that one of West Streeting's ideas, a plan to cut the amount doctors contribute to their own pension pots in order to fund a bigger take-home pay rise, is still on the table. This is a classic robbing Peter to pay Paul scenario. The British Medical Association has appeared to publicly rule this option out, seeing it for what it is, not a real pay rise, but a dangerous mortgaging of their future financial security for a short-term gain today. Yet, sources close to the negotiations whisper that it hasn't been completely dismissed by the government. This adds a layer of intrigue and mistrust to the entire process. Are the public statements from the union just posturing? Or is the government trying to push a deal that doctors have already rejected, hoping the pressure of an impending strike will force them to reconsider? One government insider suggested there was enough common ground to strike a deal on working conditions, even if the pay issue remains a toxic divider, claiming there were lots of areas where we agree. But this optimism is not shared by the doctors' union, who see these non-pay offers as a deliberate attempt to sidestep the central issue that has driven them to the brink of this drastic action. The stakes in this confrontation could not be higher, and the potential human cost is horrifying to contemplate. The threat of this upcoming strike is amplified by a chilling new tactic. Reports claim that unions have instructed their members not to inform their hospitals in advance if they intend to walk out. This move is a strategic escalation. It makes it incredibly difficult, if not impossible, for National Health Service trusts to plan for adequate cover. They will be flying blind, unsure of which departments will be staffed and which will be left empty. To understand the potential impact, we only need to look at the data from the last series of walkouts. During 44 days of industrial action in 2023, the consequences were severe and measurable. Figures from National Health Service England show a staggering 31% drop in cancer operations. Behind each percentage point is a human story of fear and uncertainty. A 31% drop in cancer operations translates to thousands of individuals whose treatment is delayed, whose prognosis could worsen with every passing week. A 13% drop in emergency heart surgery means people in the midst of a life-threatening crisis facing a lottery of care. And the ripple effects spread far wider. For every canceled operation, there are dozens of canceled outpatient appointments, diagnostic scans, and follow-up consultations. The already monumental waiting lists, a source of national shame, will inevitably swell to even more unmanageable proportions. This places an unimaginable strain not only on the patients, but also on the non-striking staff, the consultants, specialist nurses, and other healthcare professionals who are left to firefight, to triage care, and to manage the fallout, all while their own exhaustion and burnout levels reach critical new heights. And here is the terrifying kicker. During those previous strikes, many hospitals were aware of the number of doctors they needed to cover for. They could scramble, call in consultants, and make contingency plans. This time, with hospitals potentially being kept in the dark until the very last minute, the impact on patient care could be exponentially worse. It's a high-stakes gamble by the unions, designed to maximize pressure on the government, but it's a gamble where the health and safety of patients across the country are the chips on the table. The British Medical Association, for its part, maintains that its hand is being forced. They insist they remain open to talks to avert the strike, but claim that ministers have yet to make what they call a credible offer. In a sharply worded letter sent to Health Secretary Wes Streeting, the contents of which were seen by the iPaper, the union's frustration is palpable. "We are, as we have said, committed to meeting with you to settle our dispute and avoid strike action," the letter begins, before delivering a powerful rebuke. It warns that not only are you unwilling to talk about pay, but you have not identified any non-pay issues for discussion either. This directly contradicts the government insider's claim that there are many areas of agreement. The union effectively accuses the government of coming to the table empty-handed, with no new proposals on pay and no concrete, detailed offers on working conditions either. They ask, pointedly, "We are interested to know how you intend to resolve the dispute without any movement to address our pay erosion." The union's reference to the failure to deliver on past commitments, such as the review into rotational training and exception reporting, is particularly damning. Exception reporting is a crucial safety mechanism, a system designed to allow doctors to officially log instances where their working hours exceed safe limits or where their training opportunities are missed due to service provision pressures. For the government to have allegedly stalled on improving such a fundamental system, one that is meant to protect both doctors and patients from the dangers of an overworked workforce, is seen by the union as a profound breach of faith. It suggests a pattern of behavior, making promises on non-pay issues to diffuse a crisis, only to let those commitments wither on the vine once the immediate threat has passed. This history is precisely why the British Medical Association is now laser-focused on pay restoration. A percentage point is a hard, quantifiable number that cannot be easily fudged or forgotten in a report that barely gets off the ground. So here we stand, at a crossroads. On one side, a government that says its wallet is empty for pay, but is willing to rearrange the entire hiring system and tinker with working conditions. On the other, a generation of doctors who feel devalued, overworked, and whose trust has been eroded over 16 long years, who see the pay dispute as a matter of professional survival and respect. There is no easy answer. Is prioritizing UK doctors a fair solution that helps our homegrown talent, or is it a cynical ploy? Can improvements to working conditions ever truly compensate for a 20% loss in real-world income? As the clock ticks down to the 25th of July, the future of the National Health Service hangs precariously in the balance. The outcome of this fight will not only determine the future for thousands of doctors, but will also send ripples through the entire healthcare system, affecting every single person in the country who depends on it in their hour of need. This story is evolving by the hour, and the final resolution is far from certain. To stay fully informed with more in-depth analysis as this situation develops, make sure you subscribe to the channel and hit that notification bell. You will not want to miss what happens next.